Good morning, and thank you for waking up with me on Up with India. Today, I'll be interviewing Dr. Nina Anderson of TOVA Healthcare, who's here to discuss the impact of sickle cell disease that affects millions of people around the world. Dr. Nina is here to spread awareness because September is Sickle Cell Disease Awareness Month. Bringing her in on the show now, Dr. Nina Anderson, thank you so much for being here.
Thank you for having me, India.
Absolutely. I am excited to have this conversation, particularly because it is Sickle Cell Disease Month. So, first things first, I really want to talk to you about where the inspiration came from for you to get into this line of work.
I think it came from my parents. My mother was a nurse, a pediatric nurse who fought for children with disabilities to be educated in the public school system. And my father was a teacher and worked a lot with African American males, making sure that they had access to high quality education. So I think having both parents who were advocates on different lines of the spectrum really made me want to get into the area of sickle cell because it was such an unmet need that predominantly affects people in the African American community. So my parents always shared with me, if you get your education, you come back and you serve your community. So that's why I became interested in sickle cell. I graduated from Thomas Jefferson University with a doctorate in nursing practice, yes. And I'm a UD guy too.
Okay, UD, that's what I'm talking about. Blue hens all the way. I went to Delaware State University, but I still have left UD.
So I love Delaware State too.
Good. So your background is actually in chronic disease management, holistic health, and sickle cell anemia. For our audience that is unaware about sickle cell disease, can you share more information about exactly what it is?
So sickle cell is an inherited genetic disorder that affects the blood cells. Under certain conditions, being stress, infection, weather changes, the blood cells become misshapen in a form of a sickle, like a C. And when you're not getting enough oxygen and nutrients circulating to your tissues and your organs, it can cause excruciating pain. We also know that sickle cell is a very complex chronic condition, so it also affects the vasculature of the blood cells. So over time, they can be damaged as well.
So many people affected by this one disease alone. From 1989 to 1993, an average of 75,000 hospitalizations due to sickle cell disease. Why is the disease still prevalent in 2020?
You know, that's a loaded question. And, you know, sickle cell is one of the most studied genetic disorders in the whole world. And we've known about it since the early 1900s. You know, honestly, I think because it predominantly affects people of African American descent here, there has been a fight for resources, access to care, access to comprehensive centers, which many of us have fought very hard for, to make sure that even though sickle cell is the most studied genetic disorder, that it has access to funding, research, high quality care as other genetic disorders like cystic fibrosis or hemophilia.
How is the sickle cell disease actually caused? What causes sickle cell?
Well, it's you're born with it, so it's not that it's caused, but you know, thousands of years ago, our ancestors had to overcome another pandemic besides COVID, which was malaria that killed millions of people. And so the body mutated, it adapted. And so those who had cells that were kind of misshapen or sickle, the malaria parasite couldn't penetrate into the host cell. And so those genes were passed on. So it's a way that the body mutated to protect itself and to survive.
Does it put patients at risk for other things? And what are some of those things that it would put someone at risk for?
Well, there's many comorbidities or complications that people can have living with sickle cell, because we know the blood flows everywhere through the body. So when there's a lack of blood flow to any part of our organ, it can cause damage. So it can affect the organs, the heart, the kidneys, the liver, the joints. If you're not getting enough oxygen and nutrients circulating through the joints, they can flatten and cause problems. You don't think about the eyes, but the eyes need circulation, so they can cause retinopathy, damage to the retinal vessels. So any part of the body that blood flows through, that there's a possibility there could be some complications from that.
You talked about it earlier, touched on it just a bit about the demographic that sickle cell affects. 100,000 Americans are affected by sickle cell, but about 1 in 13 African American babies are born with a sickle cell trait. Are there any direct reasons for this particular community being so affected by the disease?
That's a good question, and I don't know the answer to that. But we know that in populations where there's in the tropical regions of the world, which tend to be the warmest areas where there's a lot of melanated people, then we that's a population that could be prominently affected. But we live in a very migratory world now where there's many blended communities that come together. So we can't necessarily say that, okay, yes, because you're African American or someone of Caucasian or Mediterranean ancestry, that they wouldn't be affected as well.
What would you say are some myths or misconceptions about the disease itself?
I think the stigmatization around sickle cell disease in itself, that's one of the things that I try to caution people, because disease has such a negative connotation, that they're not can't be healthy, they can't live up optimal quality of life because they have sickle cell anemia. So I say sickle cell anemia, not sickle cell disease. But just the fact that because it predominantly affects people of African descent in this country, there tends to be a negative connotation in the healthcare community, as well as those affected with sickle cell traits. Some of them may feel that they are discriminated in the workplace or also in the athletic arena as well.
Are there any treatment options for sickle cell, which I'm sure there are, but if you could just share with our audience, what are some treatment options for someone that is living with sickle cell?
Well, I'm really excited to report in our newsletter that we put out quarterly, one of the featured articles that I wrote was that I said this future of sickle cell looks bright. And what I mean is because we now have 3 new disease modifying therapies or treatment options we can offer patients with sickle cell. So Novartis has a new medication called Adakveo, which helps to reduce sickling in the blood. Also, Indari makes a new medication. Indari is a new medication made by Manus Life Science that also helps reduce the stress in the red cell to stop the sickling process. And then there's another drug by GB2 called Voxelotor that just came out of the market recently to help the red cells carry oxygen better. And so I'm really excited to report that when I first started 20 years ago, we were excited because we had hydroxyurea, which was the first drug that was FDA approved for sickle cell back in the 1990s. But now we have 3 more additional treatment options. And so that is quite exciting.
Are treatment options expensive for the average American?
Yes, fighting to get approval for these medications, they're not cheap at all. I mean, they can cost a couple thousand to even more a month for the medication itself. That we have really fought hard in the sickle cell community to make sure that these disease modifying therapies are covered. And we also have worked with insurance companies to make sure that these prior authorizations go through so that they can have access to these medications.
One of your focus is holistic healthcare. How have you been able to integrate that into your comprehensive prevention or healing plan?
I think one of the things that I feel that's very important is to make sure that your mind, your body, and your spirit is in a sense of balance. And so traditionally, if a patient is having sickle cell crisis, we give them pain medications, we give them IV fluids. But I transformed the paradigm in which care is rendered because I also focused on mindfulness meditation, teaching them cognitive behavior techniques to reduce stress, to help them stay centered, and that they have these tools that they can use to help them manage a crisis by just altering their state of mind and making sure that they're calm, they're cool and collected, and know that there's a beginning to a crisis and there's an end to their crisis. So some of those things are important. Also making sure that they have a good family support, that they have people around them that love and care about them. That goes a long way. And also simple things like getting plenty of rest and getting high quality sleep, making sure they eat a lot of fruits and vegetables, colorful vegetables, because they're full of antioxidants and vitamins. All of these things are very important in keeping somebody healthy who has a chronic condition like sickle cell.
How did you become an advocate for this? I mean, of course, through the work that you do, but what makes you want to take that extra step to get out here and start spreading awareness? You were a part of the Global Health Conference in Korea. I want to talk a little bit about that experience and how things
Yeah.
with that. But what really inspired you to become an advocate?
You know, like I said, I used to take care of children with sickle cell. One of the things I noticed in the early part of my career that, there were nurses and also doctors that didn't really want to take care of them or thought that these were difficult patients to really provide services to. And a lot of that goes back to the stigma of having sickle cell. I wanted my patients to know that there are people that want to set the bar high for them, and that I have every expectation for them to live the highest quality of life possible, to be able to manage their pain, to be able to do the things that they want to do in their lives. And that just takes somebody who's passionate, who is wants to make sure that there's resources, that there's a different innovative model of care available to meet their needs. So I was just coming in to say, look, they deserve the best. Let's give them the best.
How was that conference? It was the Save the World Global Forum in Korea in 2019. How was that conference, and what were you talking about and speaking about during that time?
Wow. It was phenomenal. And I want to say I just happened to be at a health fair I was invited to, and was, sharing information about sickle cell and the importance of, our community having access to preventative care and what holistic care means. But they asked me, the We Love You Foundation asked me, so how could you be a partner with our organization to help us spread awareness about sickle cell? One of the things I said is that we need more African Americans in the community to donate blood for people with sickle cell, because African American blood is special because it can match those with sickle cell who need monthly transfusions because they're severely anemic, or they develop an acute chest or a severe pneumonia and they have to get a blood transfusion. But also in our community, only about 1% of our community are blood donors. And though 50 to 60% of us are type O blood, which is a universal donor of the blood that is more in demand in hospitals, as a community, we have to do better. I was so excited that the community in Korea was very interested in my platform. They were interested in what I had to say, and were really interested in working with me to make sure that we increase the awareness about the importance of blood donors in the African American community for sickle cell.
With everything going on in the world right now, we're literally in the midst of a pandemic with another disease floating around,
Mhm.
COVID-19. So many people have fears about what that could mean to them. With someone living with sickle cell, what does COVID-19 mean? Is this a life or death situation if they contract COVID-19?
Well, in the sickle cell community, because their immune system is suppressed and somewhat weakened, though they can become severely ill if they get a severe form of COVID. So it is can be a life death situation for them. But be encouraged. I have really tried to work with them on learning how holistically to manage a sickle cell crisis at home, providing them with telemonitoring equipment, being able to connect with them virtually through telemedicine platforms, and let them know that they have to try to do their best to stay out of the emergency room, to flatten the curve if they can. But if they do have to go, we want them to be treated. But it's given them an opportunity to learn more about themselves, to learn how to manage pain at home, and to know that I'm still there with them. And even though we're physically distancing, we're still connected.
So many of us have, in a sense, became pseudo medical professionals. We all think we know everything about everything because of COVID-19, doing our research. But there are a lot of diseases that people don't look into. They don't know what the symptoms look like. What are some of the symptoms for sickle cell that someone would be able to say, oh, maybe I should go and get this checked out. Maybe I am being affected by this disease?
Well, newborn screening started in the early 90s. So most babies in the United States, were screened and tested and they're found out at birth. But, rare occasions, there are those who slip through and have lived many years not knowing that they've had sickle cell. And I've, had the opportunity to diagnose those patients as well. But, it's just like aching joints, intermittent pain that they may have. In their joints, or just recurrent illnesses, colds, or things that they just constantly get. Maybe they may notice that their blood count is a little bit on the low side. That may be something where they might want to get checked for sickle cell as well. But it's those recurrent flare-ups of just like achiness or a pain crisis in the joint that usually may need to be into a little bit more. And sometimes it may be just their blood count's just a little bit low and nobody's really said anything or addressed that.
Is there any cure for the disease?
Well, I'm excited to report we just had a virtual forum on the 18th, which was called Surviving and Thriving After Gene Therapy. And I had an opportunity to interview a young lady in Ohio that was cured of her sickle cell disease through a gene therapy clinical trial. So gene therapy holds a lot of promise towards a universal cure because it is it's actually repairing that miscoded gene in the red cell that codes for sickle cell. And if you can, and it's like almost like a sci-fi episode, but they use a lentivirus vector virus to get into the host cell of the DNA of the red cell, and they repair it, and then they give it back to the patient. And I had an opportunity to talk to a renowned researcher in gene therapy research. And this young lady is in her 20s. She took the leap of faith to participate in a clinical trial because she had suffered severe bouts of sickle cell pain crisis where she was almost in the hospital once a month, having to battle that. And she wanted a better life for herself. And I'm so excited to report that her blood cells are no longer making sickle cells. And she has on her bucket list for her winter, one of her winter goals is to build a snowman. And that cold weather can trigger a crisis. And she wants to do that because she never had an opportunity to do that as a child. So that's very exciting.
Very, very exciting. That's Makia Butler that you're talking about.
Yes, that's correct.
What was some advice that she was able to give to those that are still living with sickle cell to inspire them to keep going? Did she give any advice or words of encouragement?
Well, one of the things I thought was so empowering of her to have to make that decision as a 19 or 20-year-old in her maturity level to do that. But one of the things that she said is she did it. And she said she knows the risk that it may not work or she could have suffered a bad outcome like death. But she wanted to make the quality of life better for those with sickle cell coming after her. And so to me, that was something that stood very prominent to me in my interview with her, is that she wanted to make lives better for those coming before and after her. So she was a trailblazer, knowing that this approach is very early on in the phase. It's like a phase 1 clinical trial. But if we can better understand how to tweak the protocol, to constantly adjust the medications and the way in which we approach this, many different approaches to gene therapy that are going on, all of the clinical trials in the country, it's going to be a game changer for those coming after her, so that we will be able to one day have a universal cure for sickle cell.
A very selfless young woman, very brave too. You talk a lot about some of the medical treatment that can help with sickle cell. Do you think that becoming a vegan is an option? Do you think that changing your diet would actually help with the disease? I know that there has been a big, craze. Everyone is switching over, they're trying to take a healthier approach to life. Do you think that that helps?
Absolutely. As I said, everything in moderation, but a vegan diet is full of antioxidants and nutrients. And we know that our immune system plays a huge part in how we heal, how our body responds to illnesses and viruses that we are exposed to. And just overall, you feel better if your weight is in a safe range, if your blood pressure is in a safe range, if you have diabetes and your hemoglobin A1C is in a safe range. So diet is very important, as well as exercise. And also, like I said, getting plenty of rest and just having a good attitude and a positive attitude about life.
Why did you start TOVA Healthcare? And take me back to the beginning of that, of how it was created, and just talk to me about why. Why?
So as I said before, I mean, unfortunately, I have lost, people and patients from sickle cell, and I think that they became my inspiration to try to make sure that there was more awareness, there was access to high quality care treatment options for those living with sickle cell. James Fossett was one of my first patients here in Delaware when I created this innovative model, a partnership with Johns Hopkins, to make sure that those in Delaware had access to high quality care. Um, but it was just the suffering. I mean, he was someone that had leg ulcers. He lived with pain every day of his life, but he still kept a positive attitude and wanted to make sure that others that came after him had access to better care. They didn't have to fight with their healthcare providers to get the care that they needed, that they would believe him when he went to the emergency room and he was in crisis and get adequate pain management treatment. So I would say it was more or less from those who were actually living with the disease, those who are here and those who have left us, that really pushed me to continue forward, to say, yes, I'm going to take this leap of faith, dive in and see what I can do to make things better.
Would you say that you are really an advocate for African American patients, considering the fact that you kind of spoke on it a little bit, and we're seeing this in the news where there's more people coming out talking about the fact that their pain is not being taken as serious when they enter the emergency room, when they go to the doctor? Why is this happening, and what are some things that we can do to stop this from happening?
Well, that's so many years of systemic racism that we experience. And even myself as a healthcare provider have experienced racism from healthcare providers not being adequately treated for pain as well when I had a procedure done. Um, I think that as African Americans, that we need to demand better and know that we should have access to high quality care just like anyone else. And that, there's a lot of stigma, especially around sickle cell, the negative connotation and going into the hospital, the way we look. But everybody should be taken seriously when they come to the hospital, that their concerns be addressed in a manner, and that they should develop a good relationship with a primary care provider that can take them through that journey.
Do you feel a um, responsibility to focus on people that particularly look like you?
I would say there's such an unmet need. And when you look at all of the different mortality and morbidity rates, and especially around COVID, we seem to fare the worst. I think it's something that we really need to address. And I think it's important that our community know that there are healthcare providers that look like themselves and that are willing to take care of them and to provide a high quality care experience. And I think that every person should have that opportunity.
You were honored as the NAACP Health Advocate of the Year for the work that you do, Dr. Nina. What did that award mean to you?
It meant a lot. And I really thank all of those who have been behind me, because as you know, I am a woman-owned small business owner and have to deal with the fact that we just don't get access to the capital, the resources that we need to be able to provide the level of care and to pay my staff, to do what they do, and to know that people see that the work that I'm doing and the passion that I have to serve the community, it really was a great honor.
You talked about that award that you received. Was that from the Delaware Business Times of being a woman-owned business? What does that mean, to a community of women that look up to you? What message does that send?
For me, I see young women coming behind me and taking TOVA and doing great things and serving the community in many roles as healthcare providers, business owner, inventors. Um, it's important that even the barriers that I have had, I create a blueprint for those coming behind me. And so, even though there's a lot of resistance I've had, a lot of challenges that I've faced doing what I'm doing, just for young women to see that there is a possibility that you can do great work and be honored for that. And you can create a business model that people around the country award you for. I mean, and hey, I came from a public school system, so that is even more inspiring me.
What are some of those challenges that you had to face along the way?
Oh gosh, I mean, I could be here all day. People in the African American community, they're like, "Oh, are you the social worker?" No, it's my business. And I love social workers, but they just could not perceive me as being a healthcare provider or being a doctorally prepared nurse or a researcher or a business owner. And so, because we don't have a lot of African Americans in healthcare that look like us, and to see small business owners being able to have the option or the opportunity to serve our community, it's like, if you don't, you can't be what you can't see. And so, I come from a legacy of Black farmers, and then my grandmother's family were farmers, and we had a farm that we farmed for almost 50 years. We have 100 acres of land in Georgia. So I was very familiar with what small business ownership is. It's hard work, it's dedication, it's drive. And so it's something that they have to be able to see, and at least, if anything, be inspired to move forward and know that you can create a great business model and you can serve your community in such a way to level the benchmark of what high quality care looks like for even a disease that was almost silent 10 years ago.
Mm-hmm. How have you been able to serve the community right here in Delaware? Talk to me about some of the initiatives, programs, or events that you've had to spread more awareness in not just Wilmington, but Delaware as a whole.
Well, I also am a senior research professor at Delaware State University. So, yes, I do. I precept students and for a research project. So I'm really excited about that, giving them sort of the groundwork of what community engagement research is about. So I'm really excited, and I've had some of my students go on to go to graduate school in public policy and research in New York. So I'm excited about that. I've seen some of my students go on to become licensed clinical social workers, and they want to start their own practices. So that's really exciting. So I would say, of all the things I've done, it's to inspire others to take what I've done, to learn from my experiences and be able to do better. And so I want to see more businesses. I want to see more Black owned businesses. I want to see more nurse practitioners, more doctors serving the African American community.
That 5K walk, I think, that you have coming up, is that a part of one of your initiatives to help spread awareness? And talk to me a little bit about that for our audience to learn more.
Yeah, so this is actually our 8th or 9th year of James Fossett Sickle Cell Awareness 5K Run Walk. And as I said, James was a patient of mine who I started with when I started to create this model to provide care for adults with sickle cell when there was no sickle cell provider that would bridge the gap of pediatric care when they transitioned out of the hospital and some of the bad outcomes that resulted from that. But it was his vision to make sure that the community had an event that they could learn about sickle cell, that we would bring partnerships together with other organizations, and we would have it right in the community at Brandywine Park, so that everyone had access to be able to get there. And so unfortunately with COVID, we've had to do things differently. So it's a virtual walk, which we're still going to have this weekend, the 26th and the 27th of September. So they can walk wherever they are at a park near them. And then we also have t-shirts that we are selling. They can register at www.tovacommunityhealth.org. It's Sickle Cell Lives Matter, which is a trademark that TOVA owns. And so they can purchase a t-shirt and they can walk, and then they can hashtag Sickle Cell Lives Matter to their Facebook and Instagram page.
Sickle Cell Lives Matter. I like that. I like that. How can people keep up with the work that you do, Dr. Nina? Where can people go to learn more, whether they want to educate themselves some more on sickle cell, or they want to learn more about your company and the work that you do?
So you can go to our Facebook page at TOVA Community Health or Instagram at TOVA Community Health, or they can go to our website if they want to register or even make a donation to our 5K walk on Saturday. It's www.tovacommunityhealth.org.
What is the amount that you're looking to raise during this fundraiser? What's the goal here?
You know, I never have a goal, because I say small donations add up to big resources. So we're just grateful for any amount that anyone can provide, because we know that financially people are very challenged right now. So I was even blessed that I got a donation from someone in India for $10. That meant a lot to me, that someone follows me from all the way around the world, and they're looking at what we're doing here in Delaware. We just look to break even with the races and to continue to provide services for our clients. So we don't have an amount. We say no contribution is large or small. And if you donate $20, you can get a t-shirt.
Well, listen, I'm not surprised that someone from India donated to the cause. You have a business connection. You've been to Korea. You've spread awareness around the world. So that's really awesome. Thank you so much, Dr. Anderson, for stopping by and having this conversation with me. I really appreciate it.
And thank you for having me. Continue to do your great work as well.
Well, that wraps us, folks. Thank you so much for watching Up with India. You can follow us on social media at WITN22Wilm for more news, updates, and information. And I'll see you guys tomorrow morning.